Color flow Doppler shows no flow in the caudal vena cava. The adrenal tumor had completely obstructed the caudal vena cava, resulting in poor return of blood to the heart and a state of shock. Prognosis was grave, and the patient was euthanized. Elevated at 4.1 milligrams per deciliter, ALT was mildly elevated at 141 international units per liter. Alkaline phosphatase was elevated at 384 international units per liter, and urine-specific gravity was low at 1.013. Ultrasound showed a mildly enlarged but homogeneous liver. Actigol was recommended. Both kidneys showed severe dilation of the renal pelvis, indicating a pyelonephritis. Renal blood supply was very good. Urine culture and sensitivity, along with long-term antibiotics, was recommended. A large tumor of the left adrenal with poor vascularity was an unexpected finding. The tumor measured 25.9 millimeters in diameter and contained hyperechoic nodules and cyst-like structures. The right adrenal gland was smaller than expected at 4.5 millimeters in diameter and suspected to be suppressed due to the left adrenal tumor. An ACTH stimulation test with eventual surgical removal of the left adrenal tumor was recommended. An ultrasound recheck was requested 5 weeks later to evaluate renal pelvic response to the antibiotic therapy. 2 urine cultures had been negative. Neither kidney showed a decrease in renal pelvic diameter in response to antibiotics. The left adrenal tumor had increased slightly in size from 25 to 28 millimeters in diameter. However, in only 5 weeks, the right adrenal had increased in size from 4.5 millimeters to 24.2 millimeters. Most adrenal tumors grow slowly over a period of 2 to 3 years. This spread of the tumor to the right adrenal and rapid growth was a poor prognostic indicator. Because of the adrenal changes and poor renal response to antibiotic therapy, the owners elected euthanasia. The patient was a 14-year-old spayed female Labrador weighing 54 pounds. ALT had been chronically elevated at 239 international units per liter, and alkaline phosphatase at 1,239 international units per liter. The patient had 2 episodes of acute weakness and collapse. A radiologist diagnosed a retroperitoneal effusion on lateral radiographs. Ultrasound showed sludge and 2 gallstones in the gallbladder. The liver was enlarged but homogeneous. Long-term treatment with Actigol was recommended. Surgical removal of the gallstones might be needed. Both kidneys had a mildly dilated proximal ureter suggesting pyelonephritis. Urine culture and sensitivity along with long-term antibiotics was recommended. The retroperitoneal effusion was found at the left kidney and initially suspected to be coming from the left kidney. A hyperechoic left adrenal mass was located cranial to the retroperitoneal bleed. Further study showed the adrenal mass penetrating the aorta. Surgical removal of the left adrenal mass would not be possible. Long-term prognosis was poor to grave. The owners elected to observe the patient at home. The patient is an 18-year-old spayed female snowshoe cat weighing 9.6 pounds. A cardiac ultrasound was requested because of a persistent tachycardia of 240 beats per minute, a gallop rhythm, and systemic hypertension of 190 millimeters of mercury. Ultrasound showed a restrictive cardiomyopathy without atrial enlargement. Muscle of the septum and left ventricular posterior wall were thickened. Abdominal ultrasound showed a hydronephrosis of the left kidney, suspected to be due to a ureteral stone. The right kidney had a dilated pelvis indicating pyelonephritis. Urine culture and sensitivity along with long-term antibiotics were recommended. Both adrenal glands showed masses with multiple hypoechoic nodules. Because of the hypertension, hyperaldosteronism was suspected. The owner declined surgery for the adrenals. Serum aldosterone levels were elevated. Atenolol was recommended for the tachycardia. Hypertension was treated with a combination of benazepril and amlodipine. Spironolactone was given to block effects of aldosterone. Note that in cats, advanced adrenal tumors do not look anything like a normal adrenal gland. The patient is a 12-year-old neutered male standard poodle weighing 55 pounds. Ultrasound was requested because of sudden onset of vomiting and extreme lethargy. A ventrodorsal thoracic radiograph showed a very small heart, suggesting shock. Abdominal ultrasound showed an enlarged hypoechoic liver surrounded by hyperechoic fat, indicating abdominal inflammation. The spleen was very small and hypoechoic, suggesting contraction and a shock-like state. The kidneys showed dilation of medullary blood vessels. A large left adrenal tumor was found cranial to the left kidney. Note the celiac and cranial mesenteric arteries. The original left adrenal gland was located and the tumor was growing laterally from it. Power Doppler of the aorta showed blood flow, but power Doppler of the caudal vena cava did not show blood flow. A tumor of the right adrenal gland was found. Further study showed that the right adrenal tumor was invading the caudal vena cava. Color flow Doppler shows no flow in the caudal vena cava. The adrenal tumor had completely obstructed the caudal vena cava, resulting in poor return of blood to the heart and a state of shock. Prognosis was grave and the patient was euthanized.